are a certain percentage of patients who will have kidney stones that harbor bacteria, apart from the infectious stones, the struvite stones that we know.
This is part 2 of our interview with Dr. Kymora Scotland, who is a US-based urologist that specializes in endourology and stone disease. You can learn more about Dr. Scotland's background in part 1. In this chat, we'll be covering more on kidney stones and their possible connection to recurrent UTI. So let's move on to treatment a bit then. Is there a kind of a size where you would say to someone, let's just see if it passes on its own versus intervening somehow?
Yeah, if somebody has a stone that's 5 millimeters or smaller, especially if we've been able to manage their pain, because sometimes folks will have kidney stones, they'll have pain, they'll come into the emergency room, and we can't get your pain under control,
Mm-hmm.
or you're still having vomiting, you're having fevers or chills. Those are situations where it's not safe for you to go home and try to pass it. So we will treat your stone then and there, or at least we will, place a stent, which is something that I'll talk about a little bit later,
Mm-hmm.
just to sort of drain the kidney so that you don't have that issue.
Okay.
But in the case where we've been able to manage your pain, and you're, at least comfortable and able to go back and, carry out your daily activities, then we'll give you an opportunity to try to pass the stone if it's a reasonable size. And I think reasonable is about 5 or less. Now, there are some patients who have recurrent stones and who've passed multiple stones before. So even in that case, a larger stone they might be able to pass. I've had patients who, have passed a 1 centimeter stone, believe it or not. And
Mm-hmm.
so in those patients, I'll give them a little bit more leeway. If your pain is under control, I will tend to give you some time to pass it. Depending on the size of the stone and where the stone is, there are some medications that we can give you to help to relax the ureter so that you're able to pass the stone a little bit more easily.
Okay, and if that isn't possible, what are the next options?
It all depends on the size of the stone. If we're talking about a patient who is trying to pass a stone, then it's probably of a small to medium size, in which case there are two options that we would be considering, and those are shockwave lithotripsy and ureteroscopy. Shockwave lithotripsy is what is most patients, I think, favorite procedure, if you have to say there's a favorite procedure,
Mm-hmm.
because it's not invasive. And what I mean by that is it's a situation where we will have the patient lay back on the table, and we'll use a probe. We'll put that probe on their back, and then we use sound waves to break up the stone. So we're not going into the body at all. We're not making any cuts or incisions. And so patients are really happy with that, generally speaking. Most of my patients who have shockwave lithotripsy are doing well after the procedure.
Mm-hmm.
Most people are back at work the next day. And so it's something that we try to offer if it looks like it's an appropriate stone in terms of the size, in terms of the how hard we think the stone is. And we can tell how hard it is based on imaging for the most
Okay.
part. Sometimes it just doesn't look like it's going to work. And sometimes, even when we try shockwave lithotripsy, it doesn't work. It doesn't break up the stone, or we're not able to identify the stone. And
Mm-hmm.
so we move on to ureteroscopy. Ureteroscopy, it has rapidly become really the first option for most urologists, I would say, primarily because it has a better outcome than shockwave lithotripsy. Shockwave lithotripsy, despite the fact that patients do pretty well, has a 70% success rate,
Okay.
whereas ureteroscopy has about a 92% success rate.
Right.
So most doctors, will talk to their patients about ureteroscopy because it's more likely that it will work.
Yeah.
Now, uteroscopy is also, for most people, will be an outpatient procedure. You come in that day, you leave that day. But we will put you to sleep. And while there's no cuts, what we will do is we will go into your urethra, which is the tube you urinate out of. We'll go into your urethra, up your bladder, into the ureter, if that's where the stone is. And we'll do that with a scope. That scope has a camera on the end so that we're able to see on a monitor. And then once we get to the stone, whether it's in the ureter or the kidney, we will use a laser fiber to break it up.
Mm-hmm.
Sometimes the stone is small enough that we're able to just grab it with a basket. But most of the time, we're going to have to break it up with a laser fiber, and then we take those pieces out. Afterwards, most urologists, in most cases, will place a stent. I mentioned that stent earlier. What that
Mm-hmm.
is it's a tube that goes from the kidney down to all the way down the ureter to the bladder. So it's quite long,
Mm-hmm.
and it allows drainage of urine from the kidney. Okay. And so it's something that we will sometimes do after ureteroscopy, or we will do if a patient, for instance, comes in with a stone that seems like it's infected. So they've got a stone, they're passing it, they've got fevers, chills. We're going to place a stent. And what that will do is it will drain the kidney so we can get all that urine out. And then we'll come back later and treat the stone. Stones
Okay.
can be uncomfortable.
Yeah.
I should mention that. So for those patients who have had ureteroscopy before, the stents can be uncomfortable as well. Um, but that tends to be what we do. The third procedure is something called PCNL, and that's for people who have really large stones.
Mm-hmm.
And PCNL, or percutaneous nephrolithotomy, is a procedure where we do have to make an incision. So what we will tend to do is we'll go into the back and make a small incision, and then we have to tunnel into the kidney to get to the stone. If you've got lots of stone, then we need a little bit of a larger instrument to get that stone broken up and get it all suctioned out of the kidney. So we'll do PCNL.
Okay. How long does a stent stay in if you do need to use one?
It really depends. In a situation where the ureter looks fine after the procedure and we think it just needs a couple of days, when you go in with a scope or when you've had a stone in the ureter for a while, it can cause some irritation
Mm-hmm.
and some inflammation, some swelling of the ureter. So if you think you need a couple of days for that swelling to sort of go down on its own while you're draining things, I, sometimes I will only leave a stent for about 3 days if I think it doesn't need to stay for very long. But, it can be anywhere from, that to, up to 2 weeks,
Okay.
depending on how things look. If there is any damage to the ureter from the stone or during the surgery, the physician might decide to leave it for even longer. So it really all
Okay.
depends.
And then when the stent is removed, is that also under general anesthetic?
No, so there are different circumstances in which you will remove a stent. If you've got to go back and do another procedure, potentially you might use anesthesia. But in those cases where, for instance, like I said, I will leave a stent for 3 days,
Mm-hmm.
the patient might actually remove the stent, him or herself. We can leave a string connected to the stent, and it sounds crazy,
Mm-hmm.
but it you can actually just grab that string and the stent will come with it. And everybody looks at me when I say that with just horror in their eyes, but it doesn't actually hurt. Most of
Okay.
my patients will tell me that it feels like, something's pulling, which it is. You're pulling the stent, but it doesn't tend to hurt. Most of my patients who I will keep a stent for a little bit longer in will come into clinic and we can take the stent out there. So you don't need anesthesia for that.
Okay.
We do what's called a cystoscopy where we go in with a scope just to the bladder. And, we have a monitor there so you can actually look at the whole procedure with me if you'd like. Some people say yes, some people say no. And then we go in and you can see the stent right there. We just grab the stent. And again, it doesn't hurt. So we tend to give just local anesthesia at most.
Okay. That is very interesting. I did not realize you could pull that out yourself. What
Mhm.
are the risks involved in the options that you just listed?
So for shockwave lithotripsy, you can sometimes have a risk of, blood in the urine.
Mm-hmm.
You can have some pain. Okay, I've had a handful of patients who do have some pain that requires a little bit more pain medicine. Most people do fine with, ibuprofen. You can have what's called a hematoma. A hematoma is a bruise,
Mm-hmm.
especially if there is a stone in the kidney that we're trying to treat. There's a small percentage of patients who can have a hematoma afterwards. That's something that we just will monitor with time and make sure that all is well with potentially serial ultrasounds. With ureteroscopy, most of the side effects or the risks of the procedure really have to do with the stent. There's a very small chance that when we go in with a scope, we might cause some injury to the ureter or the kidney.
Mm-hmm.
But primarily after that procedure, most people will have stent-related pain or discomfort. The stent can also cause irritation at the bladder, so you can have urgency and frequency, this burning with urination, the symptoms that you unfortunately can have with a UTI.
Mm-hmm.
But the major thing I think most people will find is that stents can cause blood in your urine, and so you can have a bloody urine off and on for the duration of the time you have the stent.
Okay. Is there a particular treatment option that is most suited to a particular type of stone, or is it really about the size?
For the most part, it's about the size. Okay, if you've got a large stone, you're going to be talking about PCNL. There are some circumstances in which you might want to talk about ureteroscopy,
Mm-hmm.
but possibly then you would have to do repeated ureteroscopies. There are certain types of stones where you really want to make sure that you get every last bit out, specifically struvite stones, which are the infectious stones, as I mentioned. And so sometimes with that, you may do a PCNL, even if it's a medium sized stone, just because you want to make sure that you get every last bit out. As long as it's a smaller stone, you're thinking about ureteroscopy or shockwave.
Okay. And with kidney stones, is there a risk of long-term kidney damage?
For most people, if you've got one or two small stones, there's less of a concern with damage, especially if they're just sitting there, you've not passed any stones, you just know you have them. For people who have repeated stone passage, there can be a risk of, long-term damage. We can eventually, and this is people, like I said, who have repeated stones over and over and over, we can over years see a decrease in your kidney function.
Okay.
For folks who've had multiple procedures, we can sometimes see that with time. But generally speaking, what will happen in that case is then, your urologists, your nephrologists are going to be really closely following you and trying to make sure that we avoid any further injury to your kidney.
Okay. A couple of people asked the question, and you touched on this briefly, about whether there are any over-the-counter supplements that can dissolve kidney stones.
So I should be careful here when I say this
Mhm.
because there is a medication that you can take, or I should say there are a couple of medications that you can take for uric acid stones
Mhm.
that can sometimes dissolve them. Uric acid stones are the only stones as of right now that are able to be dissolved with medication. There are lots of things that people will see online that claim to dissolve stones and that claim to prevent kidney stones. There are a lot of um, uh, herbal formulations, natural things. If you go online, there are just, I mean, hundreds of them.
Mhm.
Uh, what I will say is that there is very little data to support any of this. There are some studies that have been done for certain things like Shankapitra and some other things that folks will have heard of, um, that show what I would call equivocal data, where it may work in vitro, and in vitro is in the lab, but
Mhm.
it's not necessarily been shown to work in animals or in humans. Um, there are some of these supplements and things that have been investigated and they've not been shown, full right out. They've not been shown to really make a difference. But most of the things that are online have never been tested. And so it's unclear whether they're helpful. And
Mhm.
so, I have my patients will come and they'll talk to me about these things. And what I will do is I'll ask them to have me take a look at it, see what the ingredients are. And if the ingredients don't look like they are, you know, concerning for me, and I'll explain what that means in a minute, then I'll tell them, hey, listen, I don't know if it's going to help. It doesn't look to me like it will hurt. And
Mhm.
so if you'd like to try it, I don't really have a problem with it. I tend to be of the opinion that, we don't know everything as doctors. And so I'm not going to tell you, flat out that these things don't work. I just don't see any, data to support them.
Mhm.
Now, what I mean by, whether there are ingredients that will hurt them, well, there are some ingredients that are thought to be healthy that can be associated with stone formation.
Okay.
So, for instance, lots of folks will take turmeric, and it's become one of the things in the last few years that people think is a cure all. And, I don't. have any thoughts either way about turmeric, except for the fact that I know that turmeric actually breaks down into oxalate. And
Hmm.
so I've had lots of patients come in who have been taking a ton of turmeric, especially, during the pandemic now. And they've never had stones before and now have stones. I've also seen a lot of people who take excessive amounts of vitamin C supplements. Now, vitamin C also breaks down into oxalate. And
Hmm.
so the data there is not entirely clear as to whether vitamin C causes stones. Okay, I should mention that. It's a little bit equivocal, it's controversial, but there's really no reason for folks to be taking excessive amounts of vitamin C in any event. So I will, just caution them about things like that. So you'll talk to people about those kinds of things that could be problematic. But generally speaking, you know, if people are taking things and they're not problematic, I don't have an opinion either way.
Hmm. I know a lot of people would be taking high doses of vitamin C if they're on a HIPREX protocol. Do you think that might be an issue?
So, I don't see a lot of patients who are on Hiprex for recurrent UTIs who then subsequently form stones.
Okay.
So I think it's fine. If you've
Okay.
not formed stones before, and especially if you don't have calcium oxalate stones, then, vitamin C for most people tends to be not a problem.
Right. Okay. So let's talk a little bit more about the connection between UTI and kidney stones. So a lot of people were asking if it's kidney stones that might be harboring bacteria that continuously cause the UTI symptoms. And we briefly discussed the other way around whether UTI could lead to kidney stones. The other questions on this topic were whether biofilms form on kidney stones and could then contribute to chronic infection. What are your thoughts on that?
Okay. So again, there are a certain percentage of patients who um, will have kidney stones that harbor bacteria. Um, you know, Apart from the infectious stones, the struvite stones that we know. And so what I do with those patients is once I treat the stone, we tend to find that their UTIs go away. So, if you are a person who has recurrent UTIs and you've got kidney stones, um, it may be something to consider.
Hmm.
In terms of whether biofilm form on stones, well, it's interesting because that's actually one of the things that I'm working on right
Hmm.
now. We don't necessarily know that yet.
Okay.
Um, I also do research. I have my own laboratory, and my team is looking at this question. Um, but there's not really been data to confirm this yet.
When do you think you might be able to?
Hopefully, I will have some data for publication in the next year or so. So
That's
stay tuned.
exciting. Yeah, we will. You'll have to send it to us so we can share it. The other question around the bacteria being harbored by kidney stones is when they are broken up using one of those techniques, could that release bacteria into the urine and then cause infection as a result of treating kidney stones?
So that could be the case. So in the case of a patient who has had recurrent UTIs and they're coming to see me because their doctor has said, hey, this person has stones. Not quite sure why she or he keeps having these infections. What can you treat her stones or his stones? I will, like I said, send a urine culture.
Hmm.
We will also try to treat that person if they've got infections with antibiotics. And so what we're hoping is that they wouldn't end up with an infection afterwards. If
Right.
that's not been thought about, it's something that would be worth talking to your urologist about. If you've got stones and you've also got recurrent UTIs, you're going to have a procedure done. Maybe just talk with your urologist and ask them if they've been sending cultures, because that would be the best way to figure that out. If you've got stones and those stones are being cleared, it's unlikely that you would continue to have a UTI unless, again, another stone forms. So, have a discussion with your urologist to try and send it off for culture so that you can know one way or the other.
Okay. Great. And you mentioned that some bacteria release enzymes that then form struvite stones. What bacteria are most associated with stones?
So, they include things like Proteus, Klebsiella, Pseudomonas. Those are sort of the major ones that we would see.
Okay. And if someone has those particular organisms on a result, does that mean they should be getting checked for kidney stones because there's more chance?
It's something to think about, certainly, because those tend not to be, well, I shouldn't say that, because unfortunately sometimes with folks who have recurrent UTIs, they can evolve
Hmm.
from E. coli to other types of bacteria, and sometimes the bacteria that causes your UTI goes back and forth.
Yeah.
Okay. But if somebody is consistently having proteus infections, for instance, it's worth checking.
Okay. That's interesting because a lot of people do report those organisms on their results. So that's good information that they might want to take to their own doctor. The last questions that we got were around prognosis or long-term outlook once you have had treatment for kidney stones. What are the chances that they will return? And is it possible to resolve permanently, especially for people that seem to get them frequently?
It turns out that about 50% of people who present with one kidney stone may never have another kidney stone again.
Okay.
But I should mention that that data is quite old now. And because we've seen an increase in prevalence in recent years, I have a feeling that 50% is probably lower at this point. But that still means that some people who have stones, may never have another stone. And I
Hmm.
tell them, so a lot of times if I have a patient who comes in and let's say 30s, 40s, 50s even, and this is their first stone, they've only got one stone, I will tell them, hey, there's a chance that you may not form another stone. Let's try to work on what we call just general prevention, drink lots of water, and certain other things that I might tell them based on the type of stone.
Hmm.
But everybody else, unfortunately, who's a recurrent stone former, we have to really be a little bit more involved in their stone prevention plan.
Hmm.
I certainly have patients who've had multiple stones who we've developed a plan that works for them, and then they don't develop more stones. Okay. But you have a percentage of people, unfortunately, who will continue to have stones. What I should say, though, is that even for recurrent stone formers, you're not necessarily going to be passing stones, multiple times a year or even every year.
Hmm.
I would say most people who have stones would, if they're not having those stones managed with a prevention plan, will probably form stones every few years or so. That's not fun for anybody, and it's
No.
certainly something that we want to avoid. But there is a range in terms of how often you might form a stone or how many stones you even have. Some people come to me with 2 or 3 stones, some people come to me with 10 or 15 stones, and so those people are definitely folks that I want to work much more closely with.
Right. Is that typically how long it would take for a stone to form? A couple of years?
It depends on what kind of stone you're forming.
Okay.
So again, I keep going back to struvite stones, but struvite stones can form in weeks.
Right.
Uric acid stones can form in weeks to months. Uh, Calcium oxalate stones tend to take a little bit longer. So it really depends on the type of stone, and sometimes the type of patient. If you're forming calcium oxalate stones and it's just, we think, a dietary issue,
Hmm.
it might take a little bit longer to form. Some people form calcium oxalate stones for certain medical issues, those can form faster. So it depends on why you're forming the stones, and it depends on what kind of stone it is. And sometimes you just have to work with your physicians based on those two factors.
Okay. And you've mentioned water a couple of times for prevention. Are there other things that people can be doing in general to try to prevent stone formation?
So water in general, like I mentioned, and I keep saying water, but really it's a lot of water.
Hmm.
And so we tell people, depending on size, I tell people anywhere from 2 to 3 liters of water a day is what you should be drinking. So
Right.
we're talking about 85 to 90 ounces. It's a lot. But the water can be in the form of actual water, fruit,
Hmm.
juices, although I don't recommend drinking lots of juices because there's lots of sugar associated with juices. Um, some people, will drink soda, which I don't necessarily recommend that you drink soda every day, but if you're gonna drink soda, I tell people to drink the lemon type sodas, mostly because they contain something called citrate, which brings me to the next thing that I tell people. So, for most calcium based stones, for folks who have um, uric acid stones, for folks who have cysteine stones, we will ask them to try to increase their citrate intake. So, what's citrate? Citrate is a basic form of citric acid, which is found in citrus fruits like lemons, limes, grapefruits, oranges, tangerines, mandarins, cantaloupes, those types of things. And so we will tell people who have either a low citrate in their urine or who have stones that we think would benefit from increased citrate intake to try that in their diet, up to and including taking medication that contains citrate or that can convert citrate in their body. Um, Another thing that I will do is, depending on the type of stone and depending on what you're telling me your diet is I may tell you to cut down on your meat intake.
Mm-hmm.
I'm not saying you have to stop eating meat, but I will tell people to try to cut down on how much meat they're eating. And again, when I say meat, I mean all types of animal product,
Mm-hmm.
um, not just red meat. Um, but really, the two major things that I tell people are water and salt. Most types of stones that you form will benefit from decreased salt.
Okay.
Okay. And I tell people that, a lot of times it's not the salt that we ourselves are putting into our food with the salt shaker. A lot of times it's the food that we're eating, out of the home. So at restaurants, at food trucks, they use a lot of salt because salt is, flavorful.
Delicious.
um, the other thing that we'll notice is that, if you're buying things from the grocery store that's in a can, a bag, a container of some sort, there's probably a fair amount of salt in there because salt is a good preservative and it's very cheap. So I ask people to look at how much sodium
Mm-hmm.
is in the back of their favorite foods that they get from the grocery store, and just to keep their sodium intake down.
Okay. In terms of diet, is there any research to show that a vegetarian or vegan diet might be better?
Not necessarily. And the reason I say that is because, yes, we're talking about decreasing your meat intake, and that's helpful for certain types of stones and
Mm-hmm.
certain types of patients. Um, but you have some patients who are vegetarian or vegan who eat a lot of really healthy green leafy vegetables, lots of nuts, lots of berries, which again, as I mentioned,
Mm-hmm.
can be high in oxalate. And so, unfortunately, there's not a very easy yes or no to that question. It all depends on what kind of stones you form and what kind of diet you are taking. And you may have to work with your urologist, your nephrologist, or even a dietitian sometimes to help you get on a diet that can prevent your stones while keeping you healthy.
Okay. Is there any association between kidney stones and an increased risk of cancer?
There's no data to support that. No.
Okay. Well, that was the last question, aside from a couple of questions about whether patients can see you. Are you taking new patients at the moment?
Well, I am, but I should mention that I'm booking really far out.
Yeah.
But I am an endourologist, and so I do take care of patients primarily with kidney stones and with BPH, which is an enlarged prostate.
Hmm.
Um, I do tend to see lots of patients who come in for those reasons, and some patients who come in for recurrent UTIs as well. Um, that said, if there are patients without kidney stones who have recurrent UTIs, there are several of my colleagues within the department who are FPMRS, female pelvic medicine and reconstructive surgeons, who are also very skilled at taking care of patients with recurrent UTIs.
Great. Well, we'll share a link to your website with the video when we publish it.
Fantastic. Thank you.